Brought to you by Dr. Joe Ordia. Frequently asked questions about neurosurgery and pain management. Questions 46 to 50. Cigarette smoking. I start with a disclaimer. The opinions expressed here are for general information and based on my own professional experience. They are not intended to replace the advice of your healthcare provider on your particular condition.
Question number 46. A dear friend of mine has smoked cigarettes for many years. She began to experience shortness of breath, and I'm very proud of her that she chose to quit and has not smoked for over 3 months. How does smoking cigarettes affect breathing?
Answer. I join you in congratulating your friend for making the right decision and following through with it. Cigarette smoking is associated with a wide range of serious health hazards involving the respiratory, cardiovascular, and other systems. Smoking irritates the airways and lungs, leading to inflammation, increased mucus production, swelling and narrowing of the air passages. The symptoms can include shortness of breath, wheezing, chronic cough, and fatigue. Long-term effects include chronic obstructive pulmonary disease, COPD, chronic bronchitis, and emphysema. Tobacco is carcinogenic, and there is strong scientific evidence that cigarette smoking is the leading cause of lung cancer, accounting for about 80%. Additional information at cancer.org. Smoking is also closely linked to cancers of the mouth, throat, esophagus, kidney, cervix, liver, urinary bladder, pancreas, stomach, colon, and rectum.
Question number 47. How does cigarette smoking affect the cardiovascular system?
Answer. Smoking damages blood vessels because the nicotine in tobacco causes narrowing of the arteries, which results in loss of elasticity, a buildup of plaque, otherwise known as atherosclerosis, narrowing of the coronary, cerebral, and peripheral arteries, increases the risk of heart attack, stroke, and poor arterial supply to the legs and arms.
Question number 48. In your discussion of the COVID-19 emergency on your website, you said that not all heroes wear capes, and that some wear helmets. You will be pleased to hear that I have a friend who is a retired firefighter and a true hero. I recently drove him to a meeting of a patient support group at a spine clinic, and nearly every speaker highlighted the harmful impact of smoking. What are the effects of smoking on the spine?
Answer. I salute your friend and other firefighters who bravely confront fires and other dangers to rescue and save others. In my previous answer, I mentioned that nicotine damages and narrows blood vessels. Decreased blood flow to the spine can lead to the development or worsening of disc degeneration, osteoporosis, back pain, and even nerve compression. For patients who are undergoing spinal surgery, impaired blood and oxygen supply increases the risk of poor healing of bone and wound. Smokers are more likely to develop post-operative complications such as pneumonia and blood clot in the leg, deep venous thrombosis. Some spinal fusion surgeries are not ideal for smokers given the high rate of non-union. Patients are typically advised to stop using smoking, vaping, and other nicotine products, including patches and gums, for 4 to 6 weeks before undergoing non-emergency surgery. Some centers will conduct a urine analysis to confirm that the body is free of nicotine before proceeding with surgery. While abstaining from nicotine for at least 4 weeks after surgery is beneficial, some providers advise at least 3 months. In my opinion, the best course of action is to quit permanently.
Question number 49. Does cigarette smoking have any effect on pain?
Answer, yes. The active ingredient in cigarette, nicotine, binds with the area of the brain known as the limbic system and triggers the release of dopamine. This neurotransmitter promotes the production of endogenous opioids, has analgesic effects and may provide some short-term pain relief, euphoria, and a false sense of feeling good. However, chronic cigarette smoking has numerous adverse effects on the causation, perception, and treatment of pain. Long-term exposure to nicotine can cause tolerance, desensitization in the pain pathways, and increased sensitivity to pain, a condition known as hyperalgesia syndrome. Smokers often report higher intensity of chronic pain compared to non-smokers. Impairment of blood supply to the spine and the resulting degenerative disc disease and osteoporosis can cause back pain. Pain management is generally more challenging because smokers may require higher doses of pain medications to achieve the same level of pain relief as non-smokers.
Question number 50. What resources are available to people who have a hard time quitting cigarette smoking?
Answer. Cigarette smoking can be addictive, and people who are looking to quit often require counseling, support, and assistance. Some people choose to begin with self-effort. They might find the addition of one or more of the following resources to be beneficial. 1. Telephone line 1-800-QUIT-NOW. 2. Mobile app Quit Start. 3. Online site smokefree.gov. Others prefer counseling, either individually, in a local group setting, or by attending Nicotine Anonymous meetings. Regardless of the option chosen, it is advisable to consult with the healthcare provider to receive personalized advice and guidance. Exploring additional options, such as nicotine replacement therapy, to reduce craving and withdrawal symptoms may be beneficial. Quitting smoking provides numerous immediate and long-term health benefits with significant improvement in overall well-being and quality of life. The life expectancy of non-smokers or those who quit smoking is about 10 years longer than those who continue to smoke. I don't want to be philosophical, but I call your attention to the famous quotation, "If at first you don't succeed, try again." The expression is a call for perseverance and persistence. The quote, "You never fail until you stop trying," is often attributed to Albert Einstein, and is a powerful reminder that with persistence and relentless effort, we can achieve our highest goals. Please don't give up your efforts to quit. Every stride you take is a step towards a healthier life for you and for others who may be exposed to secondhand smoke. Extinguish your cigarette and light up a brighter future.